Well, welcome back to Your Optimum Health. I'm Jeff Harrison, along with our expert,
Dr. Edmund Chein.
Dr. Chein. This is a series on mold, and we started the background. This last segment we talked about the symptoms, which was quite long. If you haven't seen that and you saw the first one but you missed the second one, go back and download. There's a free download on there on the symptoms that you'll know. Hey, am I affected by mold? Today, I'm excited to hear that mold is not something that if you have this, it's not something you just have to live with. It's not like chronic fatigue syndrome where they just put an umbrella and said, you just have to live with this. Dr. Chein is known for he cures things. And so today, you get to present 3 cases where you've had issues of mold and you've cured people. I can't wait to hear about that. You ready to go?
Yes,
Let's do it.
Ready to go.
Let's do it.
I want to talk about the first case.
Okay.
And first case, in fact, it's a 75-year-old lady who's been to multiple doctors. Here's criteria number 1. She had multiple symptoms. I'm going to read it off, and it's going to shock you. Multiple symptoms and multiple systems. Many systems were involved. Okay, click in my head. Okay, and when she came to me, do you think I am into longevity? She said, I want to live long, but it looks like I'm not going to make it.
Yeah.
With all the symptoms I have. The most serious one? The most serious one is diarrhea every day. That only Lomotil narcotic-like drug can control it. I don't take that, boom, it comes back. Bingo. Do we have the other symptoms? Yes, I actually gave her a checklist. The list that you talked about last time that you're going to post on the internet.
Yes. I
gave her the list. Go check. I was shocked that she was checking them off.
Wow.
Okay, here goes the list. Okay.
Wow.
Diarrhea is what's most important. Click, ding, in my head. But she goes on. Fatigue, headaches, shoulder weakness, aches and pains, cramps in the leg at night, lightning bolt pain, light sensitivity. She had to wear sunglasses before. Now, never had to wear sunglasses. Now she had to wear sunglasses. Sinus problem. We talked about that last session.
Yeah.
Whoa, bingo. Okay. Cough, shortness of breath. Bingo. Last time we talked about that. Morning stiffness, vertigo. We talked about that. Neurological system. What's diarrhea's got to go with vertigo?
Yeah.
Nothing.
Yeah.
This lady's crazy. You're nuts. Okay. You're a hypochondriac.
Yeah.
No. Memory problems, doctor. Inattention, confusion, word loss more now than ever. Okay. Difficulty learning new knowledge. Can't assimilate. Just reading a newspaper or whatever. I just have a hard time now, harder and harder. Disorientation. There are times when, she went out and her husband says she was disoriented. Morning stiffness, temperature dysregulation.
Oh, wow.
And she is a very good patient. She is just on estrogen and progesterone, shouldn't have menopausal symptoms, but she has temperature up and down, hot and cold. So when I add these, certainly more than 8.
I was going to say, Dr. Chein, that's way more than 8.
More than 8.
Wow.
Plus the diarrhea. Multi-doctor. That's my bag. That's right. That's it. Okay. And what did I do? I first immediately do a visual contrast study. By the way, that's the easiest test for these mold patients. In fact, there's a name now. I want to bring it out at this point.
Okay.
It's called chronic inflammatory response syndrome, CIRS.
Gotcha.
Okay, you're going to hear more and more of that now. Eventually, CIRS is going to be like chronic fatigue syndrome. It's going to be all over the internet, all over the verbiage of laymen. That they will be able to say, I have CIRS.
So is that another one of those labels like chronic fatigue syndrome?
No, the CIRS is specifically for this condition.
Gotcha. Okay. All right.
For mold or Lyme.
Okay. All right.
And these patients are diagnosed through the test that I will mention on the next session.
Gotcha.
And they will have positive tests.
Because in the next session, we're going to talk about what tests to take to find out for sure you do have. Okay.
Yes.
Gotcha.
So
okay.
the first test I do is the easy one. is a visual contrast study. Okay, and it's a visual. It's a little. You can find out internet. Just type in visual contrast study, and you can see what the test is like.
Okay.
But don't spend the $10 that they charge, because it's not accurate.
Okay.
I don't know why. Maybe the screen resolution, for some reason, just I got a lot of false negatives.
Oh, really? Okay.
Yeah, and false positives.
Okay.
In fact, to be how bad this test is over the internet, all my employees, 8 of them in the office, test out positive.
Oh, really?
It scared the daylight out of me. I said, the building had to be torn down. We're going to move out.
Wow.
And when I presented the real test, no, they all passed. So that's why don't do the internet test.
Wow.
Don't spend that $10. Go to a doctor who has a visual contrast study.
Okay, and you have that.
I
here.
have that in the
Okay,
office.
all
Okay,
right.
it's a pretty cheap. If you can buy it on the internet, it's $250.
Okay.
Okay, buy it and do it, or go to a doctor who do it. It should be for free, because it's part of the consultation, and it basically check out your ability to read the contrast lines. Okay, the lines are going up, down, or to the left, or to the right, and each time it shows up, you're going to say left, up, right, 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 up, left. You got to keep. It's getting more and more difficult.
Okay.
More and more finer, and somewhere you'll fail if you have more problems or CIRS.
Interesting. Okay.
And when you fail and you get treated, your readings improve to the point where it's normal.
Sure.
And that's the first sign, cheap, free, that your doctor is on the right track.
Gotcha.
Because your visual contrast study is getting better.
Okay.
That's one of the first signs. Why is a visual contrast study getting better? Why is the first thing to get better? It's your neurological system.
Okay.
Your inflammation to your visual nerves, your optic nerves, and your brain, the visual acuity area. The inflammation is causing them unable to read the contrast.
So just a little side note on that, and you've talked about this in your other programs about inflammation.
Inflammation.
And that releases. Maybe you'll correct me if I'm wrong, but when we have inflammation, then we send out our little soldiers to deal with that, right?
Absolutely.
And so when we reduce the inflammation, return to normal.
First thing to return to normal.
Yeah.
Even before the mold, the patient could have the mold in the body still showing up in the urine.
Okay.
Still the toxins.
Okay.
But the visual contrast study.
So that's step one.
First thing to normal.
Okay. All
So
right.
she found right in front of me.
failed.
She failed. Okay.
Okay.
So it confirmed.
I don't laugh because I'm saying but she failed right in front of you because it doesn't.
Yeah.
It's not one of these that you have to send away, right?
No.
It's like
no,
right there.
Right there.
Okay.
And funny enough, none of the doctors in her town that she has it.
Wow.
She called all over the place. She had to climb into town. I do telemedicine, right?
Tell us about that.
Well, telemedicine meaning you can be in Russia and I can be your doctor. If you want to be my patient for my problems that I don't need to examine you with, like ophthalmology, you got to see the eye. Gynecology, you got to spread the legs, right? Cardiology, you got to listen, right? But mine, hormones, mold, Lyme, it's all laboratory.
Okay.
I am a laboratory doctor.
Based on data.
Based on data.
Okay.
And I change those data, that's good enough. So you can be in Russia, I never need to see you.
So if you can do that visual test, like
Skype.
I'm looking behind the camera there is a huge television, and you're doing the Skype call, so you could actually do that test. If I lived in some small town in Montana that my doctors don't have this, you could do that with me, right?
No, that's what I'm trying to say.
Oh,
that's the only reason you got to fly into Palm Springs this time.
So I do have to come.
Because a visual contrast study, nobody does it in Montana.
Gotcha.
No doctor has it.
But could you do that with me?
That shows how many doctors are uneducated, by the way.
Gotcha.
Yeah.
Gotcha. But could I do that? Could you give me that test through their telemedicine?
No,
I just have to physically be there.
Yeah.
Because of like you said earlier, because of the contrast or the resolution
Correct.
of that screen. Gotcha. Okay. All right. So
That's,
I do have to.
That's why all my
Hey,
staff.
it's not a bad place to vacation, especially in Montana if it's snowing, and it's a pretty good place to come, right?
Yeah.
All right.
Okay.
So that's the first
Interesting,
test.
huh? Yeah. Interesting. Then, bingo, my deduction. Okay. What are the 2 possible conditions that can have a visual contrast study abnormality? Lyme, mold. Okay? Right there. She could have a Lyme. Did you have Lyme infected before? Yes, I did. Confusing, isn't it?
Yeah.
Yes, I did. I did Lyme infection before. So, could she have Lyme right now? Mistreated, like I said earlier.
Yeah.
Lyme have 5 bacteria, and
Right.
people, treated one and didn't test the other 4, and missed out. She still has the other one of the other 4 in it. That could cause this, right? So I did a Lyme study, DNA, urine test, for all 5, negative.
Oh,
No, she doesn't have Lyme.
okay.
Even though she was infected with Lyme, she had a Lyme history. No, all cure.
Okay.
The doctor did a good job, cure her. Okay, so these symptoms are not from the Lyme. Okay, then I did the inflammatory blood tests. Okay, inflammatory blood tests that I'm going to talk about next session.
Okay.
The tests that we do for mold.
Okay.
Okay, and I did a Marcon.
Where that one
Yeah.
bacteria.
Yeah,
It-
stick it
okay.
up the nose and
Okay.
send it off with a special lab.
Okay.
Positive,
Wow.
Marcon positive.
Okay.
Okay, and at the same time the blood test came back. She flung the inflammatory hormones, VIP hormone, MSH hormone. You don't need to know the name, but these are sepsis tests that we do. And it's abnormal in mold, in
Okay.
CIRS. Okay, so what did I do? I treated her with toxin binders that will bind the mold toxin,
Okay.
which is cholestyramine. Again, you don't need to know the drug. You have to see a doctor anyway. So your doctor should prescribe that for you to bind the toxins, okay, and replace her with the deficient immune hormones, okay, which is VIP,
Okay.
in short. And she's getting better.
Wow.
And eventually, and of course, she's doing an ERMI test that I talk about, ERMI.
About her home.
Her home, yes.
Okay.
It's from her home, definitely.
Okay.
And then it's going to show abnormal, and we're going to do remediation, of course. Otherwise, she will forever be my patient.
Yeah.
Ever and ever and ever. She won't get well until the remediation happens. Removal from the toxin, the mycotoxin. Then she'll get a cure.
Yeah. Wow.
Hopefully, she doesn't have to sell the house.
So this particular patient, Dr. Chein, like what kind of time frame from the point where you diagnosed her and started treating her that she started seeing changes?
Few months.
Really?
Yes, because tests takes time. The blood test takes time.
Yeah.
The Marcon takes time.
And
You know.
she's somebody from out of the area as well.
If you're around the area.
Okay, all
yeah,
right.
yeah. And then also doing the trying the binders, the mycotoxin binders, cholestyramine it's called, and try that. It takes 4 weeks
Okay.
to bind it out,
Okay.
to bind the toxins, mycotoxins.
And once they bind it, is that something that they
They
urinate?
lock onto,
Okay.
and then they pass on in feces.
Okay, gotcha.
Yeah, they lock onto what this treatment does is lock onto the mycotoxin and bring them out, lock it in. So even when you are exposed, still at your place of water damage building, that you still can improve because I took out the poisons.
Right.
Yeah.
Right. Okay.
With this binder continuously until your environment has changed, your exposure has changed. Yes.
So this was a patient that was already your patient because of her desire?
No, it was referred here because of Chen's doctor who diagnoses crazy problems. Okay,
Yeah.
Either say he's a crazy doctor or he diagnosed crazy problems.
Yeah.
Go check him out.
Yeah. Almost like we talked about. It's like there ought to be this little tag for you. Is like you're the doctor who cures, not controls. And
Let me put it this way: the
Okay.
only doctor, perhaps the only few doctors in the country, who's licensed both as a physician and a private investigative detective.
so that's kind of like
I'm a detective.
So you love doing that stuff.
I learned it,
Yeah.
and my name's going out. Hey, you want to see a Dr. MD detective licensed both ways?
Yeah.
There is one, Palm Springs.
Yeah.
He will, like a detective, find out what's wrong with you.
Like Columbo, you just keep digging.
exactly.
Yeah.
Exactly.
I love that.
So basically, there it is. She was referred in by another dentist, by the way. Yeah. and you gotta go, Jen. And she told the dentist a story about fixing teeth. And I've been to doctors. I said, multi-doctor, multi-symptom, multi-system,
Yeah.
and a diarrhea that nobody cures. Oh, go see the detective.
Yeah. Yeah.
That's how she was referred here.
So that was your first case study. You have two more.
Yes.
Okay.
Yes.
So